All right. Good morning, everybody. I'm Austin Rowland. I'm an associate vet up at Northwest Equine Performance. I'm joined today by Dr. Mark Revenaugh, founder and owner of Northwest Equine Performance, and Dr. Phoebe Smith, who's an internal medicine specialist from California, who's given her geographic location, has dealt with some of this wildfire and smoke in the past. So we're kind of meeting today just to try to assimilate the information that we know regarding, we all look outside our windows this morning here in the Pacific Northwest, and we can agree the air quality is quite poor. My app's telling me the AQI is 414 this morning where we sit. So, we just wanted to kind of get together and try to assimilate some information regarding what's known and what this means to us as humans, especially our equine athletes that we're all working with and managing. So we'll go ahead and dive in here. I think the first thing that we'll just kind of gloss over is, what is AQI, and how does it relate to air quality? What does that 414 really mean? So Dr. Smith, if you want to kind of weigh in on that for us.
Sure. AQI, Air Quality Index, is a measure of the air quality, and most of them are using most of the air quality index numbers that you'll find are using four major pollutants in the air. With the wildfires currently, it's the particles that are the biggie. Ground ozone, carbon monoxide, et cetera, are less relevant right now. Certainly in all of the West, it's the particulates related to burning a lot of wood, but also everything else it burns becomes a particle of some size in the air. So the cars, the homes, the plastics, all the things that are burning become pollutants. And so that AQI is a number that is derived by people who study this. I don't know how to do that, but to give us some indication of safety levels.
Yeah, and I would add in there that just conceptually we talk about the lungs as their function is just to get oxygen into the bloodstream, which is their primary function, but it's also to filter the air and clean the air. And so if you take out your air filter in your house and just look at what it looks like, that's really the same thing that's in your horses and your own lungs in some capacity. And the more air that you pass through it, the dirtier the filter is going to be. So what's different about a living species is you can't just pull the filter out and replace it, right? It's a long process to get all those particulates back out of the respiratory tract. And unfortunately, that can be a real difficult process. And that's really, to me, at the crux of what this conversation is about.
That's a really good point. And the additional number that you'll see on the AQI related to the particles that get stuck in the air filter in the lung are the small ones, 5 microns or less. So when you open your app, if you're doing that or studying air quality, you'll see the majority of the particulates are the small ones. They're the 2.5. You'll see PM 2.5. That means that's a tiny particle that gets stuck in human lungs way deep down. It's so tiny, and also in horse lungs. Above 5 microns, those particles usually get filtered out by the upper airway. But when you see big numbers on the PM 2.5, that's the stuff that gets stuck way down in the lungs.
Absolutely. So, I think with kind of the nature of what we do oftentimes in equine medicine is, we don't have large volume studies in our equine patients to work off of. So we extrapolate, information from the human medicine side. So, I think a good thing to cover would be, what is known in human athletes and the implications of exercise and poor air, with the small particle size. So,
sure. So being no expert in human medicine, but I think there's a lot of information readily available on the internet, looking at the ramifications of inhaling particulates and smoke in humans. and then sort of furthering that into human athletes. And there is a little bit of work looking at that in horses as well, which we can touch on. But the guidelines on the AQI, the green showing a safe zone, the yellow showing moderate, moving into orange, red, purple. You guys are purple to burgundy.
Yeah.
Deep purple, I think.
Yeah.
So those are really based on safety for exercising. If you sort of read and dive into that a little bit, they're recommendations for human exercise levels. We're really using very, very similar numbers, recommendations for humans exercising and horses exercising. So, the under 100 we feel pretty good about in general. The 100 to 150, we're getting into a zone that sensitive individuals and are going to be more affected. Horses without any underlying or any particular sensitivity are not going to be affected or unlikely to be in the 100 to 150. And getting above 150, we're getting into everybody will be affected to some degree, humans and horses alike. And then above 200, we know that that's just not a safe way to exercise. And in humans, there are all sorts of studies looking at the number of hospital admissions, emergency admissions during smoke. And in humans, there's more, in addition to respiratory distress, we also see a fair bit of problems with blood pressure and also with cardiac disease and severe cardiac events related to smoke inhalation. We don't know about cardiac events in horses, but it's interesting just to note that in humans.
Absolutely. So, kind of given what we've talked about so far, it seems the consensus is certainly that, there's risk to exercising horses and humans alike when the air quality is like this. I think one of the burning questions that follows is, when after the air quality becomes acceptable again, when can we start to exercise these horses, and what should that look like ideally?
So that's probably the hardest question to pin down, but you're right. Sort of the question everybody really wants to know: when. It's pretty easy to say when it's purple outside your office. Yeah. You're not going to exercise now, but if it clears up in 2 days, can you start riding? Unfortunately, the answer is you shouldn't. That air filter cannot be cleaned that quickly. So if the lung is an air filter, it actually takes some time for that to resolve. And how much time? It's a minimum of 2 weeks and sort of a maximum of 6 weeks. But given the degree of smoke in your area and the AQI numbers that you're getting, 2 weeks would be, I guess, bare minimum of still continued respiratory rest. So not breathing hard, fast, or deeply.
Very good. So, I think one of the questions that leads in, from that is, if we are to take these horses and choose to put them back into work too soon, what are the ramifications of that? What will we see in these athletes as they get going too soon?
So we will absolutely see decreased performance. Sort of probably best case scenario is the horse doesn't act too badly, but you're not getting maximal performance. We know that the VO2 max, the maximal amount of oxygen uptake, is reduced in horses up to at least 20 days after smoke exposure. That work has been done. That's been proven. So best case scenario is you won't have the same performance level. If we think about that a little bit more deeply, if they're not getting adequate or maximal oxygen uptake, that has more to do than just their speed and their respiratory rate. That oxygen is needed for brain function, for muscle and tendon, limb function. And so I guess those are some of the concerns that that decreased performance is not just your pace, right? But actually how the entire unit functions. More of a worst case scenario would be the inflammation that persists after the air clears for at least 2 weeks, and probably much longer with more severe smoke exposure, that actually results in things like bronchoconstriction, a narrowing of the airways, and the inflammation that persists inside those lungs is blocking the airways, and the horse can have severe coughing. And then by working hard with inflamed lungs and bronchoconstriction, we'll actually worsen it. So we'll have at the end of that exercise period that maybe was premature, worse inflammation than we had before we started that exercise.
So, Dr. Smith, would you relate that to having a horse with heaves? Is that a comparable end stage? Because I think a lot of people understand what that is, and I don't think anyone wants that.
No.
Is that a comparable end result if a horse were to be worked too hard? So the part of the problem is not just the particulate matter, but the body's reaction to the particulate matter. So the body's trying to get rid of the particulate matter. It becomes inflamed, and then you have all these problems that you're talking about. Is it kind of a comparable scenario? Asthma, things like that we all understand in people. Is that kind of what we could be dealing with these horses?
Absolutely. And in fact, asthma, or what we say heaves would be sort of the severe asthma, is absolutely what occurs with smoke exposure. Mild in many cases, but you could turn that mild asthma from just standing around with smoke exposure into severe asthma by working them prematurely. How long would that last? I don't know. We don't know that, but it's weeks to months as far as, and that means our training obviously is sort of put on hold if we exacerbate a mild asthma created by smoke inhalation and we push it over the edge.
So now that you've got everyone's attention, why don't we talk about what we can do to help mitigate, while the air is bad, what do we need to do, or what can we do, and what should we not do?
So there's a lot of information out there. The basics, I think, hold true across most recommendations. And the one that we already talked about, really trying to minimize the deep, heavy, fast breathing. So respiratory rest. We don't want to bring air volume in with a bunch of particulates. Another biggie is keeping the airways moist. And I don't know if everybody knows that horses drink most of their water when eating hay. They'll actually consume more water if that water is very near their hay. That's a simple one. If horses will eat wet hay, that's fantastic. We're trying to encourage just moisture in the upper airway and ideally moisture in the lower airways. So if some people are actually, sprinkling the shavings or the barn aisles just to increase the amount of moisture in the air. Dry airways, dry trachea and bronchioles, et cetera, are sort of sticky, and particulates tend to stick and stay there in dry tissues versus nice moist tissues. They can be removed by the normal defenses. So that's a primary one. Interestingly, giving steroids prophylactically, so using dexamethasone, for example, or some of our inhaled steroids, while air quality is bad, has shown to do nothing. It does not improve the inflammation while the air quality is still bad. So I think this is something I feel pretty strongly that each person should work with their veterinarian. If the horse has a previously diagnosed airway disease, has an underlying airway disease, that may be an exception. That may be a case where medications would be smart. And I think that's an individual one-on-one discussion with a veterinarian. But in general, across the board, nebulizing with steroids or giving oral or injectable steroids actually has been shown to not improve things at all. What we know is steroids can reduce the immune function, right? Smoke does that too. Smoke inhalation both directly damages the respiratory tissues and also makes the respiratory tissues more sensitive to bacteria and pollen, etc. The defense mechanisms are really subdued with smoke. So if we add dexamethasone unnecessarily on top of that, that's probably asking for trouble.
And how about just saline? Or what would you, if you're, do you recommend nebulizing? And if so, what do you recommend and how often?
So that's a loaded question. I work with a lot of athletes who do have nebulizers, and we have previously diagnosed some degree of mild asthma or inflammatory airway disease. And for many of those who are very familiar with nebulizer use, yes, I am recommending saline nebulizing. The reason I say they're familiar with it is it requires, to nebulize correctly, it requires a fair bit of cleaning. We can't just take the nebulizer, stick it on a horse, walk down the barn aisle, stick it on another horse. It actually has to be cleaned really well between horses to avoid inhaling mold spores and more particulates deeply into the lungs. And certainly from horse to horse, it has to be completely cleaned and dried in between them. So that's why I say not without a few caveats, but saline nebulizing in the right horses, I think, is appropriate.
Great. One of the other things that I think is come up that we could speak to quickly here is, should these horses, we've talked about the immune suppression that's taking place from the particulate in the lungs. Is there any rationale to prophylactic medications such as antimicrobials or anything like that, in these horses?
So my take on that is, as a blanket statement, no, but I think this is a time when anybody who has a horse in smoke should be feeling very comfortable communicating with their veterinarian, because there will be cases that develop a secondary bacterial pneumonia.
Right.
I'm reluctant to say, yes, everybody should go on an antibiotic to prevent it.
Yeah.
I think in the big picture of equine health, that's probably not a very good idea. But I think if you're wondering that because your horse maybe has weird looking nasal discharge or has been coughing repeatedly for a couple of days, you shouldn't be shy. You should pick up the phone and call your veterinarian.
Are there any other symptoms that you would be telling people that would kind of give them a clue that maybe the horse is struggling and they might not otherwise pick it up?
Yeah, so some of the more subtle signs, if they're not doing something super obvious like a bunch of nasal discharge or coughing aggressively, would be nostril flare. And this is where knowing what your horse normally sort of looks like and breathes like is helpful. A resting respiratory rate above 30. Most horses at rest are breathing about 12 to 24 times per minute. So just nostril flare. So really opening up those nostrils sort of in an exaggerated fashion. And then sometimes it's just being off a little bit, not eating quite normally. The horse is acting a little despondent. Those are worth paying attention to right now.
And how about, I know we're getting a lot of questions about, should we add something, colloidal silver, eucalyptus, all kinds of stuff that people are adding into their nebulizers. What do you think of that?
I understand that a lot of people have tried that. I will tell you that a number of airways that we've looked at in horses who have been nebulized, even outside of the wildfire smoke exposure with colloidal silver, some horses respond extremely negatively to it and develop apparently an irreversible inflammation in the airway. It's pretty ugly to see those horses that respond negatively. They sort of are reacting to it. And essential oils, I have to say, it doesn't make sense to me to nebulize an essential oil. I don't think that is the planned use of essential oils. I don't think that's what we want in our airways.
And that's great. And how about, the burning, sorry, Austin, the burning question. I have to.
Yeah.
I couldn't let that go. Yeah. The burning question for everyone here is, there are horse shows coming up. It's been a crappy year for everyone. Everyone wants to get back in the game as soon as they can. There's shows coming up. How do you make that decision? What do you have guidelines for how people make decisions on when it's a good idea, or probably more importantly, when it's a bad idea to go ship 12 hours and go to another horse show?
Yes, and I bet you do too. You guys, as the leg and soundness experts, that's a big part of it. If you haven't been able to ride for 3 weeks, lungs not even considered, how are your legs ready to exercise? One of the common things that I keep hearing is, well, the air quality is good where the horse show is. But if your horse has been living with the smoke inhalation, minimum of 2 weeks of clear air, and then you have to bring them back slowly, both for their lungs so you can see how they're doing, but also for their muscles and tendons and ligaments. If they've been standing and hand walking, I think everybody knows this on the inside. They want to do more, but everybody knows you can't stand around for 2 or 3 weeks and then go show.
Austin, do you have other questions for us?
Yeah, one of the things I would love to touch on is, what other supplements? So we kind of touched on the medication prescription side of things. What are there any supplements, antioxidants, omega supplements, things like that perhaps people could be using right now to try to, boost their horse's support a little bit as they're dealing with this challenge?
So there are certainly a lot of supplements that claim to do all of those things.
Yeah, absolutely.
The ones that we know about are, as you suggest, the omega-3 and 6 fatty acid supplements.
Mm-hmm.
And of course, it's the ratio of those two. We don't want an overwhelming bunch of omega-3s. We want a nice balance. There is one commercial product called Alira that has been studied and has been shown to have some beneficial effects on airway function. And so that's an easy one to recommend. I do like vitamin E as an antioxidant as well. And we've learned a lot about vitamin E over the last number of years. And turns out the liquid forms are more, and the natural forms are more bioavailable. So those are the ones that I usually recommend.
Great. One of the things I know has come up in conversation has been something like resveratrol. Do you think there's any rationale behind that in these horses at this time, or?
Theoretically, I can see how, but I don't know that I can answer that with any.
Yeah, fair enough.
How about turning a horse out? I mean, we get that question. Well, a lot of horses have just been turned out because people had to evacuate. But, in the other scenario, you have a barn of 20 horses. Should we be turning them out, or should you wet the field first, or what do you think?
Well, that is going to probably depend on the barn and what the air quality is like inside the barn versus outside. And also, if it's a horse who's likely to be wild and woolly and running around, I don't mind a horse walking slowly outside. That's fine. That's not excessive use of the respiratory tract. And I think probably for their legs, a little walk is probably not a bad thing versus standing in a 12 by 12. I would prefer not to see horses ripping and running and bucking around, ideally, if that's what they do in turnout. Is that what you meant?
Yeah, it's a little bit of an impossible question, but I mean, do you think it's worth watering the just putting a sprinkler on the pasture before you turn them out if you're going to turn them out? Do you think that reduces particulate? Yeah.
Yes. I think that's something that we can do to reduce the amount of inhaled particulates. Yes, I agree.
Another question kind of on that note, as far as air movement and air circulation in the barns, it seems logic could see it either way as far as a fan being a good thing to be using right now to try to move the air around, or if that's going to stir up more particulate. I don't know if there's any real solid information, or what your opinion would be on that.
I think maybe that's another time where wetting before turning on a fan would be a good idea, right? If you wet the barn aisles, etc., and then turn a fan on, you'd probably get less blowing around. I think a lot of those types of decisions are going to be individual based on the barn's makeup.
One other question. I mean, we have quite a few clients who are barrel racers who have horses that are bleeders. Is there anything specifically that you might be doing differently for those horses in this scenario?
I probably wouldn't. I think all the same principles apply in terms of reducing the particulate inhalation. It is suggested anyway that the inflammation that occurs with smoke and particulate, deposition in the airways, may be a factor in bleeding. So if you weren't a bleeder before, this may contribute. And so horses who are already known to have exercise-induced pulmonary hemorrhage should really take note. That is an underlying condition that your horse has. And you should probably consider your horse in the sensitive group if that's the case.
Does that mean laying them off longer? Does that mean nebulizing more? Does that
That means using the AQI numbers for the sensitive group, right? So you're in that 100 to 150, you're sort of walking only.
So quickly, if all of a sudden the skies parted, the fires went out, the air quality is perfect, how long, what has it been, a week now, Austin? Is that right?
Yeah, just
something
about.
like that. It's been a week. So you would suggest 14 days, Dr. Smith, is that right? For the just Joe Q average with their horse before you start really ramping up the program. Is that right? Or what I don't mean to put words in your mouth. How do I advise, or how do we advise clients about returning their horses to work again? I know we've kind of touched on it, but it's a really important point. So I would ask you to maybe repeat your recommendation that way.
Sure, and I hope the skies do part and you do have this.
Well, it doesn't look super promising right now.
It'd be wonderful.
No, yeah. I did look up and look up the AQI and put it in my little app so I can keep track of what's happening with your clients up there and understand that a little bit better. It's been a week of really bad up there, right? You're in the 400s.
Yeah.
For a week. I mean, it pains me to say 2 weeks after the air clears, but there's a lot of evidence to suggest that is the minimum before you start ramping up. Yes, so if the air clears and you want to begin hand walking, you want to begin perhaps tack walking on week 2, but I mean, walking so that, again, that horse isn't moving a ton of particulates in or out, and that they have respiratory rest. Then after 2 weeks, then start ramping it up and just watching. Some of the horses after 2 weeks starting to be ramped up won't do well. And so everybody has to be attuned to their horse and say, he started coughing, did fine hand walking, started some trot work, started coughing. Then that you need to call your vet and work out. Is it coughing from some persistent inflammation? Most likely. Or is there a secondary bacterial infection now? Possible. Sorry. I know it's a long time, but.
Well, look, I mean, I think the issue is that people just need to get some information, and whether they like it or not, everyone can do with this information what they will, but at least they're given what is hopefully, as accurate as we can give right now. And hopefully over time we'll get better at giving at knowing some of this stuff. But, we got to make decisions in the here and now. So hopefully this will be helpful to the clients that see this.
Hope so.
Absolutely. So perfect. Well, unless there's anything else we ought to address, thank you so much for your time, Dr. Smith. Thanks for your time, Dr. Revenaugh. And, we'll hopefully be able to distribute this and help people get some answers to their questions. So thank you both.
Stay safe.
Thank you. Stay safe.
All right.
Take care.